Hello, good afternoon. It's Dr. Trudy Ufondu of Snowspirations Global Health Solutions, and it's weekend. Today, it's another opportunity to talk about important things in our community. So this evening, we're going to talk about sex during pregnancy or sex in pregnancy. So what are those 5 important facts you need to know about sex during pregnancy? Are there a couple of things that you should be worried about? I know so many men are currently avoiding their pregnant wives because they probably feel that the baby is going to be affected. So many worries. So many people must have told you a lot of things in pregnancy. If you noticed, as a pregnant woman, a lot of people will tell you stop. This person will tell you to do this. This person will tell you to do that. This person will tell you to eat this, don't eat that. And at the end of the day, if you're not careful, you'll be malnourished. Now, the right person to seek information about anything, be it practices, be it what you need to eat, be it what drug to take in pregnancy, is your doctor. When you go for your ANC, that's when you have an opportunity to get feedbacks. So your ANC should be an interactive kind of procedure. You go there, when you're done, giving them whatever information they need, you ask questions. So as a pregnant woman, I expect you to be proactive in getting feedbacks so you can be the number one advocate of your baby. It's very important. So let's talk about sex during pregnancy. It's anything that you should be worried about, and we're going to keep it factual. So number one, sex is allowed in pregnancy if your pregnancy is healthy. So what makes a pregnancy healthy? If you don't have any complications, if you don't have any pain, any bleeding, any water coming out of your body, if you don't have anything whatsoever that will put you in a harm's way in pregnancy, completely, you can start from day one up to when you go into labor, completely okay. What you and your partner should focus on is the position that will give you comfort, because when you're pregnant, definitely the developing baby in your womb would introduce a lot of discomfort. So the key word in sex during pregnancy is what? Comfort. So find the position that will make you to be comfortable. So once you're comfortable, you are allowed to go about having sex in pregnancy. Number two, factually, sex doesn't hurt your baby. Your baby is completely doing okay. The amniotic fluid, which is a special fluid, and the amniotic sac, which is a sac where your baby is developing, it's completely protecting your baby when you are having sex. So there is absolutely no harm to your baby. Besides the amniotic fluid and the amniotic sac, the muscles of the womb and what we call the mucous plug will protect your baby from any harm, especially the mucous plug will protect your baby from having any infection. So God is so amazing the way God designed the baby. When your baby is inside your womb, your baby is pretty much on vacation, pretty much eating, sleeping, kicking you, peeing. That's all your baby does. Your baby is completely, your baby doesn't even know what you guys are doing. So your baby is completely safe when you guys are making love in pregnancy. Now, on the flip side, some pregnancies are complicated. So by complications, I mean from day one, you started having pain, you started bleeding, you started having water coming out of your body. That's complicated pregnancy right there. If you happen to find any form of bleeding in pregnancy, you're white, you notice spotting, maybe it's implantation bleeding, maybe it's whatever, sex must be completely discontinued. Beyond that, you have to also avoid spots and stress. So there are 3 S's you have to be conversant with if you have complicated pregnancy. So complicated pregnancy can present with bleeding, with water coming out of your body, which we call premature rupture water membrane. So that amniotic fluid that protects your baby, if anything leads to the rupturing of the sac, you can leak water. When that happens, the likelihood that your baby is going to come early is very high. So if your pregnancy is complicated, completely avoid sex. Number 4 fact. Some people will be wondering, what will happen to that sperm, which is actually semen, because sperm you cannot see with your eyes. What happens to the ejaculated semen deposited inside the vagina that might likely get to the cervix? Guess what? Sperm is typically considered very safe in pregnancy, both for the woman and both for the baby. Now, most of all those sperm is gonna go through what we call denaturation. So they're gonna break down, they're gonna pass out as vaginal discharge subsequently. So there is absolutely no need to worry about that. But here is what happens. In some select pregnancies, a woman can be pregnant, and while that pregnancy is developing, she can meet with a partner or an entirely different partner, and she can become pregnant the second time. It's called superfetation. It's rare, but it can happen. So a woman can actually be carrying 2 babies in her belly, and those 2 babies are not twins. They are from 2 different fathers. I know it might sound strange, but that's what might happen in some women, especially younger women that have high fertility index. So what happens? When the woman releases the first egg, it's going to be fertilized, and for some reason, she might ovulate again and release another egg. When that happens, you can become pregnant at 2 different times. You have 2 babies in your womb, but they are not twins. They are more like siblings, which can actually come from 2 different fathers. So that's what will happen when you have a baby inside and you succeed in having another baby. So it's possible, but it's rare. Now, it's sex beneficial or harmful during pregnancy, grossly dependent on the type of pregnancy you are having. So if your pregnancy is not complicated, it creates good bonding. So what happens when you meet with your partner, you develop a lot of bonding. And when you do that, you release the feel-good hormone we call endorphins. It helps if you don't have complications. If you have complications, please avoid that. So this, in a nutshell, are the facts which you should know about sex during pregnancy. So it's completely okay because people are wired differently. There are actually some women that during pregnancy, they notice increase in their libido. If you happen to be in this category, please, it's okay. People have different ways their bodies react, and each pregnancy might be different. But you have to have common understanding with your partner. Don't deprive your partner. Now, for your male partner, understand your woman. She might be going through a lot of challenges. You have to be on the same page. There are so many other ways to still be there, get your satisfaction. The most important thing is what both of you agree on. So sex mustn't be penile, vaginal, penetrative sex. There are so many other ways you can get your satisfaction so long as you guys are on the same page. But please do not deprive your partner. So it's completely okay if it's not complicated. But if it's complicated, our duty is to make sure that the baby is delivered without any problems. Okay? So thank you so much. I'm going to give an opportunity to provide feedbacks to a few questions. So please, if you have any question, go ahead and ask right away. When it comes to sex during pregnancy, what's the safest position? So the safest position is actually the position that gives you guys more comfort. And I'm going to give you an example. You see, when a woman is lying on her back anytime in pregnancy, it's not really the best. When you are lying on your back, the pregnant womb can, sit on a particular blood vessel and can make you to gasp for breath. So lying on your back in pregnancy is not the best position. The best position to lie in pregnancy, including sleeping, is on the left side. Sometimes you can, see yourself lying on the right side, but the recommended position in your pregnancy is on the left side. So there are so many different positions out there. As an adult, you need to know what works for you. You can play around it. The key word is comfort to the woman. The man, look, I understand your comfort zone, but we are not really worried more about your own comfort. And it also depends on the trimester. If your woman is the first trimester, you wouldn't even know she's pregnant. So you guys can indulge in any style you want, but once that belly is standing on the way, definitely you're not gonna go to the missionary style and you keep pounding the belly as if it's a normal person. So you need to find a position that will be safe. That's not the time to go into acrobatics. So you can find a better position. The key word is to find what works for both of you. Okay, so there is no particular position that is prohibited, but personally, going on the missionary side, which I'm sure you're conversant with, that means the woman is lying down, the man is on top. When that's the position, you have to be mindful because the woman is going to be on a lot of discomfort. So you don't want anything that will cause any trauma, because the truth is, when you engage in lovemaking, certain things happen. Some people can go into rough aspect of it. We don't want any trauma to the baby. We don't want any trauma to the woman. Okay? Very, very good question. Does pregnancy affect sex drive? Yes. In some women, they can have increase in their drive. So they can have increase in libido. In some other women, depending on how eventful the pregnancy is going, it might be the other way around. But generally, if you don't have any problems in your pregnancy, matter of fact, those hormones that sustain your pregnancy will also lead to increase in the desire to engage in sex. But this is what I don't want you to do as a man. There are so many men that use the reason that their partner is pregnant to go messing about. The fact your woman is pregnant doesn't mean you have a license to be messing about. Do you know why? If you go out and you're not mindful and you're not careful and you pick any sexually transmitted infections and you come back and you make love to your partner, guess what will happen? You can introduce those sexually transmitted infections to your woman, to the baby. And there are so many sexually transmitted infections that can affect your baby in the wrong way, especially the viral aspect. There are some sexually transmitted infections that can lead to deafness and blindness in your baby. So you need to be careful. You see, when you have a commitment, it's no longer about you. When you guys are planning to bring forth babies into this world, there are so many compromises. If you have to go on sabbatical leave for 9 months as a man, that's okay. That's not too much of a sacrifice. After all, this lady is going to be the person that will carry this baby, go into labor, go into pain, stay up, feed the baby. What do we contribute to the equation? If we all be truthful to ourselves, men have an easy way when it comes to starting the family. So beyond providing for the money, allow your woman, meet your woman halfway. Find where her comfort zone is, meet her that way. If you have to devise other means of getting there, get there. There are so many areas in your body that can be activated and you can have the same feeling. It's a mind game. So now the woman, you also have to meet your partner, halfway. So many women might look for things to give reasons not to be there. Sex is a chemistry thing. You guys have to be on the same page. It's not the day he wants it that you want it. It's not the day she wants it that you want it. So but sometimes you might be 1%, she might be 99%. What do you do as a man? You have to heed to her own 99%. So the compromise is on you as the man, as the leader of the home. Very key question, okay? Continue asking your question. Is it safe to have sex in third trimester? It's safe to have sex throughout the whole trimesters, first trimester, second trimester, third trimester. There is no time in your pregnancy that sex is contraindicated if you have smooth, healthy pregnancy. However, if your pregnancy is compromised, if we are suspecting that you might be prone to infection, we tell you to abstain from sex. If you are bleeding, we tell you to abstain from sex. The reason is because we want to make sure that every baby gets to at least 37 weeks. If your baby gets to 37 weeks, your baby is considered 10. Okay, so throughout your pregnancy, you can run it. There are people that can run it from day one up to labor. Matter of fact, some myth believe that when you make love prior to you going into labor, it's going to facilitate labor. Completely not factual, not evidence-based, but you can engage in lovemaking and there is absolutely no problem about that, okay? Now, the next question says, Can uterine contractions during orgasm complicate an already threatened pregnancy? Very smart, intelligent question from this amazing lady. So here's the deal. During orgasms, women contract. So that contraction is due to a particular hormone we call oxytocin. It's a feel-good hormone, right? So when you contract, the level of contraction you will have when you are having orgasm is not the level of contraction you will have when your baby is about to come. But here's the catch. She is talking about a complicated pregnancy. So if you already have what we call Braxton Hicks, that's forced labor, or if you are already bleeding, or water is already coming out, or the mucous plug is already dislodged, guess what? Your baby can come anytime. So in complicated pregnancy, orgasms which might lead to contractions might complicate our pregnancy. So my recommendation, don't go there. Once your pregnancy is complicated, please abstain. The gains of abstaining far much outweighs the gain of anything you're going to get. Remember, it's all about 1 minute. That feeling of whatever sweetness you're going to get from your orgasms can only last about 1 minute. So it's a mind game. Matter of fact, if you train yourself properly, there are some men that can still achieve their ejaculation by just being in the presence of their partner. There are some people that can achieve their sexual satisfaction through so many other avenues. This is why you need to be conversant and learned about things you can do about your sexuality. Okay, so very, very technical, smart question from Kenneth. But the answer is abstain if your pregnancy is already complicated, because that particular contractions you will have when you are having orgasms can initiate a cascade, which might also lead to real labor. Okay? Very important question. So guys, keep asking more questions. So when you come in, remember we're talking about sex during pregnancy. Very important topic. So if you're currently pregnant in your first trimester, in your second trimester, in your third trimester, and suddenly you noticed, probably before now you used to enjoy lovemaking, and suddenly you no longer enjoy it, and you begin to wonder, is this what life is all about? Don't worry, a baby changes everything, right? Now, it's possible that prior to pregnancy, you didn't really need to, go in there. But lately, you want to go there. And each time you want to go there, your partner will keep telling you, oh, he's going to do this to the baby. The penis can't even get to your baby. The penis cannot even permeate through the cervix. So no matter how long your penis is, it cannot get beyond the vagina and permeate through the cervix and get into the womb. There is no such penis. So whatever you guys are doing, do whatever you're doing. The baby's on vacation, okay? But please, you need to discuss this. And discussion doesn't necessarily mean you need to make it official. Be very easily understandable. Understand the plight of your woman. Then the pregnant woman understand that it takes two to tango, right? So you also have to make sure you have provisions for your partner's needs, okay? Everybody have their needs, including the baby. Okay, so when you guys are bonding together, it's to the advantage of the baby. Because guess what? Your baby knows when you're happy. Your baby knows when you're sad. You can talk to your baby inside your womb. Do you understand that? And this is a relationship that mothers have already developed with the baby. The man is a stranger when it comes to starting the family. A woman has already established a relationship with that baby for a long time. So your baby understands you. You understand your baby. This is what happens shortly after delivery. Where is your baby going? To your breast? Because by default, they know that when they get to your bosom, they will find comfort and they will find food there. Very beautiful question. Can pregnancy sex cause premature labor? No, my dear. If everything is okay, the way it's meant to be, and you don't have any complications, and you don't have any other concomitant factors that can lead to premature labor and premature birth, pregnancy, sex, whether you're having orgasm or not, it's not really something that will complicate our pregnancy. We are only worried in an already complicated pregnancy. So if you're already bleeding, if water is already coming out of your body and you engage, maybe, but if not, completely okay. All right? Okay. Guys, let's wrap it up to 20 minutes. I have a few more minutes. If you still have any question, please go ahead and ask, and we can wrap it up. Remember, every day we normally bring a topic of great interest in our YouTube channel, and we teach, and we use it to make sure that everybody's on the same page. If today is the first day of attending our clinic, thank you so much. Remember to subscribe. Remember to set your notification, then share and check previous videos. Thank you for coming. If we don't have any other question, I'm going to take my leave. Okay, so thank you so much. If you still have questions, you can ask in real time. I'll provide you feedbacks. Remember that every last Sunday of every month, we have a masterclass. The month of August, the masterclass is going to be on ovulation. What happens when the egg is released from the ovaries? What are the factors? What are the likely problems? What are the disorders? In the event you're not ovulating, what do we do? If you've gone into menopause, what happens? What can we do to give you this beautiful journey? Because without your eggs, you can't become pregnant. Without the sperm, you can't become pregnant. So every woman must ovulate. So make sure you register for this boot camp, and we can meet you halfway. It's on Sunday, the last Sunday of this month. I believe is the 29th, 9 p.m. Nigerian time, and we'll meet you halfway. Thank you for coming. I hope I've covered all the important questions. We are going to post the transcript. Until I see you guys tomorrow. Ebenezer, what's the topic for tomorrow? Let me see if I can get the topic for tomorrow. Then I'll communicate you guys for tomorrow's topic so you can get ready, okay? Hold on. Give me just 1 minute. I'll get there. So we already have topics lined out. So tomorrow we're going to talk about BMI and fertility, body mass index. So how can your BMI, which predicts whether you're underweight, whether you're normal weight, whether you're overweight, whether you have obesity, how can your BMI affect your fertility? Okay, so keep a day with us tomorrow. 5 facts about BMI and fertility. Thank you so much for coming. God bless you, and I see you tomorrow. Also, the same tomorrow, we have another clinic, maternal and child health clinic. We're going to find another important topic, and we'll continue to promote our maternal and child health community. God bless you and enjoy your weekend. Bye-bye for now.